Hi everyone, and welcome to the micro e-learning program from the Global Parkinson's Genetics Program and the Aligning Science Across Parkinson's. My name is Cristina Simonet and I'm a consultant neurologist at Homerton University Hospital in London, and today I will talk about an overview on Parkinson's disease treatments. My talk will focus on some critical aspects of Parkinson's disease management, especially looking at different treatment strategies and their applications. We will explore oral treatments, device-assisted therapies, and non-pharmacological strategies, including the important role of exercise. Parkinson's disease is a chronic neurodegenerative condition that affects movement and is primarily caused by the gradual loss of dopamine-producing neurons in the brain. As dopamine levels decrease, patients experience symptoms such as tremor, rigidity, slowing of movement, also called bradykinesia, and lately balance impairment. While we don't yet have a cure for Parkinson's, a range of treatments is available to manage these symptoms effectively. Each of these medications play a specific role, and their use is tailored to the individual needs of the patient depending on their symptoms, disease stage, and response to treatment. Let's begin with oral medications, which are the primary approach to managing Parkinson's symptoms. The first and most widely used drug is Levodopa, which has been around for decades and remains the most effective medication for controlling symptoms in Parkinson's. Levodopa works by replacing the dopamine that the brain no longer produces, and it is usually combined with either carbidopa or beneldopa to prevent it from converting to dopamine before reaching the brain, ensuring that the maximum amount is available to alleviate symptoms. While Levodopa provides significant relief, it comes with potential side effects including nausea, dizziness, postural hypotension, and less commonly hallucinations and impulse control disorders such as gambling. Over time, as disease progresses, many patients also experience motor fluctuations. Chronic stimulation of dopamine receptors can lead to changes in receptor sensitivity and function, causing motor fluctuations which can manifest as wearing off periods when the medication effects wane before the next dose is due, or as involuntary movements called dyskinesias. These challenges make managing levodopa therapy a bit of a balancing act. Another class of medications used in treating Parkinson's disease is dopamine agonists, such as pramipexole, ropinirole, and rotigotine. These medications mimic dopamine in the brain and can be used alone in the early stages of Parkinson's disease or alongside levodopa in later stages. They are associated with a lower risk of motor complications such as dyskinesias and on and off symptoms, but are slightly less effective than levodopa. Common side effects include sleepiness, impulse control disorders, and hallucinations, particularly in patients with cognitive impairment. This means they must be prescribed carefully in all the patients and those already experiencing cognitive decline. We also have other types of medication that play a role in managing Parkinson's. For example, MAO-B inhibitors like selegiline, rasagiline, and safinamide. These drugs work by blocking the enzyme that breaks down dopamine in the brain, thereby extending the duration of levodopa's action. They are especially helpful in the early stages of the Parkinson's disease or as an ad-hoc therapy to manage symptoms better. Common side effects can include headache, nausea, and insomnia, which are generally mild but should be monitored. Moving on, we have COMT inhibitors such as entacapone, opicapone, and tolcapone, which also extend to the action of levodopa, but by preventing its breakdown outside the brain. These are typically used in combination with levodopa to help manage wearing off symptoms, and side effects can include diarrhea and in some cases orange-colored urine, or harmless but unusual side effects that can be a bit startling for patients. For those experiencing dyskinesia induced by levodopa, amantadine can provide some relief. It is an interesting drug because it was originally developed as an antiviral medication for the flu, but it has shown benefits in managing Parkinson's symptoms as well. However, we must watch out for side effects like confusion, hallucination, and ankle swelling, which can be problematic, especially in older adults. Lastly, there are anticholinergic medications such as orphenadrine, procyclidine, and dexdifenidine, which help reduce tremor and rigidity by blocking the action of acetylcholine. These are most effective in younger patients or those with tremor-dominant Parkinsonism. However, due to their potential side effects like dry mouth, constipation, and cognitive issues, they should be used cautiously, particularly in older adults or those with pre-existing cognitive concerns. I want to take a moment to discuss a critical aspect of managing Parkinson's disease that is often underestimated: the importance of maintaining consistent medication schedules. When we talk about Parkinson's disease management, we often focus on what medications to use, but it's equally important to understand the risk associated with not taking medications as prescribed. As highlighted on this slide, omitting or delaying medications can have severe consequences for patients. If a dose is missed or delayed, patients may experience acute stiffness and a sudden worsening of their underlying Parkinson's disease symptoms. These can significantly increase the risk of severe complications. For example, acute akinesia. This is a sudden inability to move, which can be frightening for the patient and dangerous, especially if they are in a situation where mobility is crucial. Aspiration pneumonia. Because Parkinson's disease often affects swallowing and respiratory function, patients are at an increased risk of aspiration pneumonia, particularly when their symptoms are not adequately controlled. Increasing risk of delirium. Delirium is a state of acute confusion that can be distressing and dangerous for the patient, especially in older adults. It can lead to a cascade of other healthy issues, including falls, prolonged hospital stays, and a decline in overall health. Parkinsonism hyperparesis syndrome. This is a rare but potentially life-threatening condition that can occur when medications are suddenly stopped or significantly delayed. It is characterized by high fever, severe rigidity, autonomic instability, and altered mental status. This syndrome can be fatal if not recognized and treated promptly. When oral medications alone are no longer sufficient to control the symptoms effectively, we consider device-aided therapies. The choice of therapy depends on careful selection of patients based on the 5-to-1 criteria. They are based on requiring at least one of these three clinical indicators of complex Parkinson's, which include requiring at least 5 times of levodopa tablets per day, experiencing off symptoms for at least 2 hours during the waking day, or having at least 1 hour of troublesome dyskinesias. 3 primary device-aided therapies are available with the common aim to maintain a constant levodopa effect in the brain. Intestinal levodopa infusion, or also called duodopa, this method delivers a continuous supply of levodopa directly to the small intestine, maintaining a stable level of the medication in the bloodstream and the brain. Subcutaneous apomorphine. This is another option, administered either through injection or continuous infusion. Apomorphine is a potent dopamine agonist and is particularly useful in reducing sudden off fluctuations. Deep brain stimulation, this is a surgical option which involves implanting electrodes in specific regions of the brain, like subthalamus nucleus or other pallidal nucleus as well. However, it is not suitable for everyone. There are several contraindications such as advanced age, dementia, speech problems, loss of balance, and structural brain lesions. This option can significantly improve quality of life. However, choosing the right therapy requires consideration of these factors as well as the patient's overall health, their ability to manage their medication, and their response to prior treatments. Lack of response of oral levodopa is a contraindication for all 3 therapies, except for those with untreatable or unresponsive tremor. We also have to consider that there can be a potential risk for treatment failure in the future in frail patients with lack of family support and no compliance with other treatments. In these instances, it is more important to treat other symptoms as the disease progresses. This is the case with dementia, which can typically be treated with rivastigmine, which is a cholinesterase inhibitor. It is also crucial to remember that treating patients with Parkinson is not just about medications or devices. Non-pharmacological strategies are equally important. We need to adopt a multidisciplinary approach to Parkinson's care. This includes input from a range of healthcare professionals such as specialist nurses, physiotherapists, occupational and speech and language therapists, dietitians, and social workers. By working together, we can address that many challenges faced by patients with Parkinson's, from managing their physical symptoms to supporting their mental and emotional well-being. In addition, exercise has been shown to improve motor symptoms, enhance cognitive function, and may even have neuroprotective effects. Regular physical activity can alter neurotransmitter levels, encourage new neuron growth, and reduce inflammation in the brain. So, encouraging patients to stay active is vital, not just for their physical health, but potentially for slowing down the progression of the disease itself. In summary, the management of Parkinson's with oral medications involves a careful balancing act. Each drug class has its benefits and potential side effects, and their use must be tailored to the individual patient's needs, the stage of the disease, and their response to treatment. It is a dynamic process that often involves adjusting the medication regime over time to achieve the best possible symptom control while minimizing side effects. In the earliest phase, here on the left part of the graph, known as the prodromal stage, symptoms might not be obviously linked to Parkinson's disease. Patients might experience non-motor symptoms like sleep disorders, loss of smell, constipation, and depression. At this point, interventions such as regular exercise might be particularly beneficial. There is also ongoing research into disease-modifying drugs that could slow down the progression of the disease in these early stages. As disease progresses, motor symptoms become more noticeable. At this point, the primary treatment often involves levodopa, sometimes in combination with other medication like MAOB inhibitors or dopamine agonists. This treatment aims to manage symptoms effectively and maintain the patient's quality of life. In the moderate stage, symptoms become more pronounced and may include anxiety, low blood pressure, dyskinesia, impulsivity, and freezing episodes. During this phase, managing the motor fluctuations and maintaining an adequate response to medication becomes more challenging. Medications such as COMT inhibitors are often introduced to help prolong the effect of levodopa and manage wearing off symptoms. Finally, in the complex stage, the disease symptoms become even more severe and may involve on and off periods, cognitive impairment, and hallucinations. At this stage, patients may not respond consistently to oral medication alone, and here, device-aided therapies such as DBS, apomorphine, and Levodopa can be considered to help manage symptoms more effectively. Thank you all for your attention, and I hope this has been a helpful overview. Bye bye.